Hello viewers, this is Dr. Kritika Manimaran, gynecologist and fertility specialist, CM Hospital, Nanganallur, Chennai. In this video, we shall talk about how to choose the best IVF clinic for your IVF services. Today the market is flooded with a lot of options. Wherever you see, there are promises and advertisements of best IVF centers across the city, in every street, every nook and corner, promising all kinds of success rates and promising all kinds of sales and marketing strategies, offering a lot of discount and 1+1 offers, money back offers, and the list is endless. But how do I know which center is right for me? Is the question that every young couple have in their mind. So in this video, we shall discuss about certain points that you need to take care of while you are choosing your right IVF center. Whatever it is, the success of IVF is in percentage, and there is no such thing as 100% success in an IVF cycle. So you need to understand this bottom line, and generally on an overall success rate, without considering into an individual case-to-case basis, is around 40 to 45%. This, by just a click in the Google, you can also check the IVF data and the success percentage data across the world. So if a particular center is claiming to give you 70%, 80%, 100% success rate, you need to rethink about the credibility of that kind of a statement. So one IVF cycle means one cycle of egg collection followed by embryo transfer as well. Only then we can say it is one completed IVF cycle. Suppose you have more embryos from that particular egg stimulation cycle, they can be transferred if your first attempt fails. So there is something called as a cumulative success rate. That is, if your first embryo transfer fails, you may need one or the second embryo transfer or a third embryo transfer. You can, a cumulative success rate for an IVF cycle may be around 60 to 70%, but per cycle it is always around 40 to 45%. We need to have realistic expectations while getting into an IVF cycle. And when it comes to discount, IVF, you need to understand, is quite the ultimate and expensive treatment proposition for a fertility issue. So it does come with a lot of expenditure. So if your clinic is promising to do at a very, very concessional cost, let us say at 50,000, 40,000 or very less, then you need to ask them what are the hidden charges that are involved in this particular discounted scheme. Because many a time in the beginning it is not clearly explained, and then there is a lot of grievances from the patient's end. Are the costs of embryo freezing involved? Are the costs of frozen embryo transfer involved? These are the questions that you need to ask your IVF center that is promising to give you at a very, very concessional rate. Because quality of the treatment should not be compromised. At the same time, if you want complete transparency in the treatment process, I think these points need to be discussed before you enter into your IVF cycle. And one more thing to be kept in mind is, as the age of the woman undergoing the IVF cycle increases, the success rate of an IVF cycle comes down. So the more and more the age of the female undergoing the IVF, the success rate can come down. Unless, of course, they are also open to the option of a donor egg cycle. So we must have realistic expectations while considering an IVF cycle at a very advanced age. Location of the IVF clinic. So very often people want to go to the nearest IVF clinic. But remember, it is a very emotionally challenging procedure. It requires of multiple visits to the hospital, and you may require to take injections frequently, period of about 10 days. So keeping this in mind, we can, if you have to travel like let's say 20 kilometers or 30 kilometers to successfully complete your IVF cycle, I think you need to think about, of course the location and proximity is important, but at the same time, are we at the best hands? Because that is a very important point towards determining your success rate. So what is really close to you may not be able to cater to your specific problem of a challenge in IVF. So you need to rethink about that. As important as a doctor's qualification is while you're choosing an IVF clinic, so also the embryologist's training and experience is also very vital, because the embryologist does almost 50% of the job in an IVF cycle. So the embryologist's skill set is very important to forming good embryos and deciding which embryos are healthy enough to be transferred into your uterus. So a best embryologist team is very essential for a successful IVF cycle. There are many centers where embryologist just comes and goes in a particular time in a month, and that's why the cycles of some women and can get compromised, and you need to know if their embryologist team is also well equipped and well trained and skilled enough to handle your embryos with ease. Each IVF clinic has a specialty in treating a particular type of problem. So you need to ask your doctor when you're starting your cycle, what is their specialty? Are they skilled enough to handle your particular problem, and how often have they faced this kind of a problem earlier? Because some clinics may reject some patients because they are not, as their policy, they are not treating this kind of a problem, and so their success rate may be high. And so in a particular clinic which deals with all kinds of even severe fertility issues, that clinic may have a lower success rate because they are facing a more challenging fertility issue. Is it important for you that the same doctor sees you every time? You need to ask yourself this question, because many times there are multiple doctors working at centers and different people are doing the scan for you. So that can have a trivial effect on the success and meticulous monitoring of your IVF cycle. Is your doctor ready to provide you continued care once your beta HCG is positive, or would you have to switch over to another hospital the moment your IVF cycle turns beta HCG positive? These are the questions that you need to discuss with your doctor, because IVF pregnancies do require extra care and attention compared to a normal spontaneous conception, because giving importance to the woman's age, the uterine condition, or the inherent hormonal pathology. So is your clinic capable of continued care for pregnancy, so that not only an successful IVF cycle but also a successful take-home baby rate is what defines the complete success of a IVF clinic. So it is very essential that your healthcare team, your doctor, embryologist and the healthcare staff, everybody hold hands with you and take you through this emotionally challenging process, so that you go home with a baby without any hassles. So these are the points that you need to discuss and get clarity about. Our center is located in Nanganallur, which is close to the Meenambakam airport. We are able to cater to patients from all over Tamil Nadu and from other states as well. And we do have some international patients also coming in. Because we are center with an attached hospital as well, we are able to ensure that our clients are satisfied, and not only a successful IVF but also a successful take-home baby rate is our motto. and thereby we are able to ensure that our couples go home as a happy family. Thank you, and if you have any doubts with regard to this, you can WhatsApp us or email us and get in touch with our team. Thank you.